WHBC.
The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, Mercy Medical Center, and, of course, our technical producer in the studio, J.D. DeAngelis. In the studio with me is Brad White, a compounding pharmacist, and our special guest, Rick Pipes, co-owner and lead of the Employees Benefits Division of Pipes Insurance. Good morning, Rick, and welcome to the show.
Good morning. Thank you.
All right, a recent study showed that only 4% of Americans understand the key terms that are necessary to understand their health insurance. The 4 key terms identified to understand your health insurance policy are the deductible, the copayment, co-insurance, and maximum out-of-pocket. Understanding these terms unlocks the mysteries of your health insurance, and they are the key to reducing your out-of-pocket expenses and saving money. This morning, we're going to talk with Rick about saving money, reducing out-of-pocket medical expenses, and using our health insurance wisely. We'd like to remind our listeners that you can subscribe to our podcast on your smartphone. Just look for Health Matters with the Medicine Center Pharmacy in the App Store, and you can take any of our programs with you anytime. If you have any questions you'd like addressed today, you can post them up on our live Facebook feed.
So, Rick, welcome to the show. And Rick has been a benefit to our company, helping us navigate the health insurance market and providing top-notch benefits for our staff. Tell us about yourself, Rick.
Paul, first of all, thank you for those kind words. I appreciate it. I'm Partners in Pipes Insurance Service, as you mentioned before. I've been doing this basically since God was a boy. I've been 27 years now doing benefits. It's all I do for our firm, even though I am a principal owner. People always tell me all the time, they're like, oh, I hate health insurance. I don't understand. It's complicated. I just tell them that's why I have a job. So,
Okay. That's exciting. All right. So, Rick, health insurance seems like a puzzle to everybody. Can you take a minute and explain those 4 key terms: deductible, co-payment, co-insurance, and maximum out-of-pocket, and why are they so critical in helping us save healthcare dollars?
sure. On a traditional preferred provider organization plan, which is a PPO, all those components exist. Most of the time, the people don't see their deductible, and we'll talk about that in a second. They have what are called copays. Copays are literally just a flat, small dollar amount that they pay for certain types of procedures. For example, you go to your general practitioner, you just pay, on average, $25 to $60, depending upon the type of physician it is. They don't see their deductible. It helps with their cash flow, so they're not having that larger expense. As well, with prescriptions, as you well know, there's tiers of copays that exist, whether it be generic type drugs, name brand type drugs, non-formulary. These range anywhere from $10 up to $300, depending upon the type of prescription. There's copays for urgent care visits. Those are the non-emergency room private facilities typically that range at about a $50 to a $75 copay. And then, of course, emergency rooms, if you have to go, typically do have a copay as well. They're getting higher and higher because of the cost of the emergency room, averaging about $150 to $300 as a copay. Now, so when do we see our deductible, and what is a deductible? Your deductible is basically for the larger expenses. Typically, we're talking outpatient services, inpatient services, diagnostic testing, perhaps even durable equipment. At that time, you have an amount of money that you spend before the insurance starts to pay from January to January that doesn't include those copays. They range, that's your deductible. It ranges from $500 all the way up to larger deductibles of $5,000. And that's how much you spend before the insurance pays. After your deductible, at that point, you share with the insurance company the cost. That is the co-insurance you're speaking of. You've probably heard of 80-20. 80-20 means that I will pay 20% of the bills after my deductible. The insurance company will pay 80% of the bills after my deductible. This will continue on and on until you hit your annual maximum out-of-pocket. In our business, we call it the MOOP. Sometimes employees like that term better, the MOOP. But when you hit that, the plan will pay 100% of the cost afterwards.
What's a MOOP again?
Maximum out-of-pocket for that person. So if you're paying your 20% after deductible, That will go to a certain point. The highest that the government allow us to have if you're using network doctors and hospitals is $8,150 for one person and double that per family.
As a deductible.
As a maximum out of pocket. Deductibles would be lower than that.
Okay. Wow.
But your deductible would be included in that because it'd be part of the maximum
Correct.
pocket.
That's correct. And at that level, because that is the highest, all your copays go towards it too. So even though they're not tracking towards your deductible, they are tracking towards that MOOP, maximum out of pocket.
So this is probably a little ahead of where you're going to go, but I'm guessing that some people that I hear roll into the pharmacy with really high deductibles, they're already almost on their way to having their maximum out of pocket done when the insurance is basically going to take over.
Correct. As a matter of fact, it's very common now to see deductibles starting at $2,500 to $5,000, but then paying 100% of the co-insurance afterwards, so that there's no more out-of-pocket maximum. You've met it at that time.
Yeah. Okay.
What about actual costs in the hospital? They on the rise? They stable?
No, unfortunately, healthcare as a whole has an inflation factor of about 13% nationally. In Ohio, we've actually been under the curve because we have a lot of competition. We range between 8 and 9% for inflation factor, but they always go up, unfortunately.
Some of the markets in our state, though, are much more expensive, correct? Like in the big cities?
For sure. In Stark and Tuscarawas County, we certainly have an advantage with better value hospitals with great care. When you go up north, they have some specialties we may not be able to accommodate, but their cost per room night, which is the bed night is how they measure the cost, is much higher up north in Cleveland or Columbus or down south in Columbus versus here.
So, what is consumer-driven healthcare, and where did it get its name?
Well, it started in 2004. Basically, what happened is the Republicans at that time under George Bush thought that their answer to health care would be, you know what, let's make people better consumers. If you have a $25 copay, as we mentioned, or a prescription copay of $10, you don't know that cost of service or that cost for prescription may be $80 or maybe $150 or frankly, could be $400. We don't know. So what they did is they created some vehicles and tools in the healthcare that allowed the consumer to see those costs with a higher deductible and none of those copays so that they can make better decisions as consumers, thus consumer-driven healthcare. When you shop for a vehicle, when you shop for anything, you compare. You don't go out and buy the expensive Porsche we just spoke about. Yeah. You do some comparative shopping, and that was the purpose behind consumer-driven healthcare.
Okay. So, can you help us with the alphabet soup and explain the differences between HDPs, high deductible plans, HSAs, or health savings accounts, or HRAs, or health reimbursement accounts? No wonder nobody understands it.
Again, this is why I have a job, right? Yeah, I just mentioned in 2004, that is when consumer-driven healthcare, that is when HSAs came out. And what they are is, first of all, you have to have a high deductible health plan, that was one of your terms, that qualifies by the IRS to have a health savings account. The deductible, the richest HSA or health savings account plan you can have with the high deductible health plan starts at $1,400 for single and $2,800 for family. That would be the absolute richest. Most of them are much higher. At that point in time, on these plans, other than preventative care, because that's always covered at 100%, you are not allowed to have those first dollar benefits as copays. So everything's under your deductible. But what you do get is you get to open up this account at a bank that is specifically for health savings account money that is guided and monitored by the IRS. Now, the employer or the employee or both can now put money into this account completely tax-free. They use this money then to pay their higher deductible, as well as the IRS lets them use this money for other items such as dental and vision, long-term care premium, LASIK eye surgery, orthodontia. I got $9,000 in my boy's teeth. So all these things qualify from your account, but what really makes them unique is I tell people this is kind of your healthcare retirement, because this money you can put $3,550 in a single or $7,100 a family, more than your deductible at times, and then it carries year after year, and the interest is tax-free as well. So hopefully I'm accumulating money so that when I retire, I can use this money towards other healthcare expenses. At age 65, I could take it out and pay taxes, but most of the time we'll just spend it down. Now, in contrast to that, so I mentioned the high deductible health plan, that's the one of your terms, and the HSA. You talked about the HRA, stands for Health Reimbursement Account. The difference between that is employer money that when you show those same type of expenses that qualify by the IRS, the employer can reimburse you for them. But if you don't use those expenses, the employer retains the money. So it's only spent if you have those expenses, where the health savings account, once it's in their account, they personally own it just like they own their 401k, and you can't take it away from them.
And with the HSA and HRA, you have to have a particular plan that qualifies to have either one of those. You can't have them both, correct?
Well, actually, you could have them both, but you have to start with the HSA and the minimum levels of deductibles. Then you could have an HRA on the backside of that.
So we got a lot of IRS stuff going on. It's not that. Yeah, okay.
Correct. And it actually, I do have plans that do that. It's a clever way, but it gets complicated.
I bet.
Okay. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Men like Paul White love Studio Arts and Glass. Why? We wrap all of his gifts. Gifts like hand-blown paperweights, ornaments, jewelry in stunning sterling silver and precious stones like amethyst and crystals. After 30 years, Studio Arts and Glass is known for creating and restoring stunning stained glass. Just ask Paul White. Studio Arts and Glass on Apple Grove and 77 in North Canton.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Rick Pipes from Pipes Insurance. Have a question? Post it on our live Facebook feed.
All right, Rick, I think all of us are amazed. I mean, I am as a pharmacist when we see the staggering costs of some of these medications, procedures, and hospital stays. Why should we care about those costs if the insurance is paying?
That's a good question. One of the things I hear all the time is these insurance companies are making all kinds of money. The reality is under the Affordable Health Care Act, they limited how much an insurance company can retain, anywhere from 15 to 20% after claims paid. They actually have to return it if they collect too much. So it is not necessarily the insurance companies, and I know I will get looked at unfavorably for that because people want to blame them. But the costs keep rising. And so when the costs rise, what happens to you as an employer who's offering health insurance is a great portion of your increase is relative to your claims specifically as to your group's health conditions. Average renewals are anywhere between 10 and 20%. You know as well as I do that most employers can't afford that type of increase, especially when they can't increase their goods and services by the same amount. Therefore, they have two options. They either increase what the employees are paying from their paycheck to accommodate the premium increase, or they adjust their plan so that there's higher deductibles, higher maximum out-of-pockets, and hit the employees who are using the plan. For these reasons, I feel that the employees need to be as engaged as the employer. And it is a team approach. It's not one or the other. It's not the employees against the employer. I've worked very hard at trying to get within the employee population and educate them with certain seminars and tools that we'll probably talk about today so that they help make good decisions, realizing they are part of how that renewal is going to look and what their contributions are going to be next year.
You know, it's interesting some of the analogies you gave, and I want to reiterate that when the insurance costs rise, I think sometimes staff members and employees get frustrated because the cost goes up out of their weekly paycheck. But it is frustrating because you're right. Like in our business, 90% of our business is paid for by the insurance companies. So they're not increasing what they pay us for prescription medications that we dispense. We have to manage those costs and try to control it. So I think education's key. So it helps to people to understand that when you have a sore throat, you don't go to the ER. But I'm sure we're going to talk about things like that in a little bit. So I'll leave that teaser for what you should do when you're feeling under the weather and what severity of action to take. So
You know, the third-party prescription plans continue to reduce our reimbursement. Okay.
Yeah.
And then some of our monies have been taken away from us, too, from the insurance companies. So we can't raise our prices, okay, to cover some of these benefits and other expenses. So it just has to.
I get the exact same argument from my physician groups. They're like, how's my costs keep going up when they keep lowering my reimbursement? Unfortunately, there's so many other factors to healthcare expense that are beyond what you do as well as what the physicians are paid to do.
And it is interesting. I mean, medications are one aspect, doctor visits are another, and then you get chronic situations when you don't want to open heart surgeries and scary things like that. So what about, well, let's get down to it. What can I do to help save money on medical costs?
Well, you need to question things. You know, it's not natural for us to ask our doctor a lot of questions. They're in a hurry sometimes. They obviously are working on their flow of patients, but we have to stop and start asking questions, including of our physicians. So find a doctor that is willing to talk to you. If they're ordering a slew of tests, ask about those tests. Ask to the cost of those tests. For example, I heard a statistic a long time ago that a PET scan is within 5% of what maybe an MRI could show you versus maybe 85% of what an X-ray could show you. And they're not all created equally, but sometimes the X-ray may present the right solution before the MRI or before the PET. And the cost difference is anywhere from $185 up to $3,000 up to $6,000. So again, education, not questioning our doctor per se, but working with them on solutions and uncovering all of the answers that you need to listen to.
And I would complement that with ask them about the medications if they know, because sometimes in their defense, some of these medications are stupid expensive and they have no idea. They read a journal, they see the study, they want to help their patient the best they can, and they feel that the results that medication may be able to provide that particular patient are what the solution calls for, but they don't know it costs $12 a tablet. And we're all kind of, I mean, I'm still amazed on a daily basis what some medications cost. So don't be afraid to ask questions about what in the same realm, you know, maybe there's another medication in the same drug class that can help in the same way, but be a whole lot more cost affordable.
Exactly. You know, they are they get the newest and best prescriptions from their pharmaceutical salespeople, and they may not know that cost is a lot more expensive, and there's alternatives.
So, what other tools can you tell us about to help save medical costs?
Well, right now, insurance companies have been becoming pretty creative to help their constituents save on costs. So, for example, there's not a carrier out there right now that if you go to their online capabilities, doesn't matter if it's Blue Cross Blue Shield, Medical Mutual, AultCare, any of the carriers, they have actually cost comparison systems. So if I'm getting a knee surgery done, I can say, listen, I'm getting the knee surgery, here's my doctor, but they can work out of several hospitals. I put those hospitals in, I put the procedure in, and they'll literally tell me what the cost of that is at each one. Now, more importantly, they also have quality ratings. I don't necessarily want to go to Knees R Us. I want to go to somebody that actually has a good success rate and a good cost. So that gives me that information as well. In addition, one of the newest things, too, that insurance companies are providing is telemedicine. This is not in lieu of your general practitioner. I don't want to offend any of my doctor friends, but it is in addition. It's something that they can access quickly. I mean, literally within 10 to 20 minutes, a licensed physician will typically call them. They're trained in telemedicine. And if we're talking rashes, light colds, allergies, things that are minor, they can treat you telephonically, over Skype, over FaceTime. And then through that, they can call a prescription into the medicine center. You can fill that within a relatively quick period of time, and that person's up and running and never left their home in a short period of time. The cost of that literally is $45 to $49 if you were to build the entire cost. So it's very affordable. And they'll communicate to your general practitioner so they have that information on your health history.
So cough, colds, flu, whatever, let's try Teladoc, or what are you saying here?
Again, I don't want to replace our general practitioner, but at times we can't get to see them promptly enough. So telemedicine can help with that, and it depends on the severity, but for sure on sinus infections, light colds, allergies, rashes, those things that you know, probably know the answer to in advance, but maybe need a prescription to remedy.
You know, there's several new, relatively new orthopedic clinics in this marketplace. I'm not sure about where, New Philly, Dover area, but I had an occasion to visit one of those a year or two ago, and I thought it was very efficient and time-saving, et cetera. Must have been cheaper. I had no way of comparing, as opposed to like going to an emergency room, and everybody keeps saying, "Don't go to the emergency room unless you're half dead." You know, that sort of
We'll
thing.
talk about that.
Yeah, for sure.
But no, the reality is when we see capitalism at its best, frankly, and physicians start their own type of services that are outside of perhaps the hospital realm, they don't have all the costs associated with that hospital, so they are more affordable.
Yeah. Sure. Well, okay, let's see. We're bottom of the hour, aren't we, JD? Let's take a break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
WHBC AM Canton, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, 2 women in their 20s have been killed on Stark County roadways in separate accidents over the last 2 days. Those accidents in Bethlehem and Sugar Creek townships. 27-year-old Jordan Montgomery of Navarre was killed in an accident on Kemery Avenue Southwest yesterday afternoon. Her car went off the road and rolled over. 19-year-old Addison Rudd of Canton charged with breaking into St. Michael Catholic Church in Plain Township last Sunday, stealing a sword and a cross. He faces a desecration charge. Kevin Fishburne of Perry Township was in court yesterday, being arraigned on a felony animal cruelty charge. He is charged with shooting his own dog in the face. He says the animal became aggressive. The dog is recovering from the gunshot wound. A possible case of the coronavirus has reared its head in Texas. It involves a Texas A&M student that traveled from Wuhan, China, where the coronavirus originated. That person was starting to experience symptoms. Millions of Americans likely to see their credit scores fall with updates to the popular FICO credit scoring criteria. People who fall behind on loan payments, run up debt, or take out personal loans to consolidate debt will probably be the hardest hit. More news coming up at 10 o'clock. I'm Pam Cook.
Hi, this is Brad White from the Medicine Center Pharmacy. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacist can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
You won't want to miss the upcoming Kiko auction on Thursday, January 30th at 4 p.m. with Bill Gill Jr. at the Kiko Auction Hall, 3201 Parkway Street, Northwest in Canton. There's a huge collection of sports memorabilia. There'll be old game bats, autographed jerseys, baseballs, mini baseball, and football helmets, photos, and more. Also, there's a Lionel Trains and other. Don't miss the auction. You will regret it. Call Bill Gill at 330-418-8727 or visit KikoAuctions.com for more information and directions.
We've extended our most recent sale at the Half Off and Hot Buy store in Louisville and have added a lot of new items. All lift chairs are reduced to $199 with many in stock. All seasonal merchandise is drastically reduced, as well as a wide selection of health and beauty products, cough, cold, and vitamins. And shop our tool aisle and toy aisles to find more bargains. Take time to shop our store and you'll find many, many values. The Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy.
Your severe weather station, News Talk 1480 WHBC.
Here's your accurate forecast for this afternoon. Rain, high 44. Rain will taper off tonight. Otherwise cloudy, low 35. Showers of rain or snow in the afternoon tomorrow, high 40. Cloudy tomorrow night with a snow shower, low 32. A few morning flurries for your Sunday. Otherwise a cloudy day, high 37. Monday, continued cloudiness, high 36. I'm Brian May for News Talk 1480 WHBC.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing tips to lower your out-of-pocket medical expenses. There's a lot more to talk about this morning, so let's get back to the show. Where are we at?
Okay, can you tell our listeners about the cost differences between things like Teladoc, StatCares, and emergency rooms?
Yeah, definitely pricing is the first issue, but obviously severity of the medical needs at hand dictates where we go as well. So we talked about Teladoc a little bit. For sure the quickest, for sure the most economical, $45 to $49 as mentioned, but they can't do everything. As we mentioned on break, they're not going to be able to take an x-ray, do stitches, take your blood pressure. If you
Don't you think that's coming? I mean, really, with the computers and some sort of a medical package, you know, that
Paul, it exists. There's packages now tied to Teladoc within school systems that has a nurse practitioner with a station that's telephonically and electronically sending the information to the doc for diagnostics. So
Interesting.
it does exist.
Well, I keep thinking about the Dr. Spock, you know, and you get this little gun, you shoot your arm and you're cured, you know?
Yeah, not quite that, not
Be
quite
nice.
that well.
We're not there yet, huh?
No. Okay, so let's say, my sons played soccer. Both of them had injuries in soccer. You don't know if it's a break, if it's a sprain, if it's that type of thing. Well, you can't do an x-ray over Teladoc.
Sure.
So that is a perfect example of when an urgent care would come in handy. That's not the emergency room. It's usually a privately owned urgent care. At that time, you go, there's a physician on hand if the hours are appropriate, and they can do an x-ray. Cost of this is on average between $300 to $600, depending on how much the imaging
On the
they're
total
doing.
visit.
On the total visit,
Yeah,
yes.
okay.
And again, closer to the 300, depending upon if they are doing imaging or not. But you get in, it's not as crowded, you get there quickly, it's a lower cost than going to the emergency room. Now, when do I go to the emergency room? Oddly enough, emergencies are coded from 1, 2, 3, 4. 1 and 2, you never need to go to the emergency room. So those are the people that probably shouldn't be there. 3 and 4, you should. So based on symptoms, which could be life-threatening, and that's diagnostic symptoms. That's not actual what's happening. Chest pains, those types of things. Then you should go to the emergency room. That's what they're for, and they do it well. Just realize that you will be in, if it's non-emergent, you will be in that waiting room for a long time with a lot of other sick people. On average, if you're there for 4 hours, which is not that long in an emergency room, the cost is going to be about $1,200. So, again, I wouldn't know why people would want to be there if it's not emergent. And now there's a lot of options that they can go to besides the emergency room.
So I know that we're seeing through the insurance companies some sort of well programs. What's the latest on this?
Great question. First of all, I like to tell people you're not necessarily healthy if you're not going to the doctor. So remember that every plan out there, because of the ACA, basically has 100% coverage for preventative care. It's very inclusive right now. It's a broad list that you can go online, and it's based on the government's programs. But PAPs and mammograms and routine physicals and colonoscopy at a certain age. Colonoscopy is $3,000. It can be paid at 100% if you're doing it in the right time when they want you to do it, as well as other things. So please first start with your preventative. Now, what else can I do? Insurance companies have had very creative programs. I actually just placed a company the other day who would give you a pedometer, or they'd actually let you work credits towards an Apple Watch, and then they monitor your steps each day. And if you hit those goals of 10,000 steps, they will either start paying off the Apple Watch, or they would give you credits into your HSA, money into your HSA, or other types of incentives from the insurance companies. Most of them have discounts at fitness centers. Most of them have discounts at Weight Watchers, Jenny Craig, those types of things. And then going further on the employer side, working with insurance companies, many of them have what's called health fairs, where we're working in conjunction with a hospital or a doctor's office. And at that time, they bring out nurses. They do a diagnostic, a baseline on everybody. And those people who seek services based on those results, they'll do follow-up to keep them healthy. My larger companies, I'm proud to say I've helped start on-site or near-site medical clinics where they're actually paying for nurse practitioners and physicians a certain amount of time during a week to see their employees, their associates, at no cost or a very, very low cost, depending upon the program, to keep them healthy, to start getting that relationship back. Because we can talk about Teladoc all day, but you need to have a relationship with somebody.
In a situation like that, a large company scenario you just described, do they do physicals, or do they do routine health care on all the employees, or?
Great question. We designed the plan so that they need to see that doctor once a year for that exact purpose, up to about a half hour. Unlike the normal pay-for-service model, we want them to spend, because they're already paid, 30 minutes or longer getting to know that employee and their family members and spending the time with them, and then working on a program to keep them healthy.
Do they do routine blood pressure checks and glucose checks and all that sort of thing?
Yes, they do.
That would be a year?
Yes, again, at least once a year, we incent the employees through the plan design to seek that type of treatment. And then again, everything is HIPAA compliant and confidential with that doctor, doesn't go back to the employer, so that patient feels comfortable sharing that information and getting those tests.
Interesting. Okay. You're up, Brad.
All right. When do you recommend a pharmacy to clients you service? And what services and characteristics do you recommend to help clients save at the pharmacy?
and I'm not just saying this because I'm on your show. I truly tell every associate, and I do group meetings and have done group meetings for thousands of employees, to form a relationship with their local pharmacy. And specifically, I do say the Medicine Center. Brad, you've taught me a ton about how pharmacy business works. And frankly, I encourage them to first thing go to you or somebody like you. Make sure that they are giving that prescription regimen to that pharmacist and doing a few things. I've seen way over prescribing from different physicians. There's no continuity. You guys can say that this works with this doesn't work with this. This is talk to their doctor on their behalf. Make sure that they're not getting overprescribed and things are working together. Just as important, the cost of those drugs, as we mentioned. They may be on the newest name brand drug that costs 10 times as much as the Lipitor that's been out forever and is at a low cost. You can help them with those decisions. And as important, over-the-counter medication. They now are coming in either or, which over-the-counter prescriptions may save them money, easier access to, on your shelves already. Flu shots, which you can do in-house. All these things lend itself, and you work with their doctor. So often I tell people, you want to keep the relationship with your doctor, but sometimes you need to let your pharmacist work with your doctor on your behalf to help you, to keep you healthy, and to help you save on costs.
Well, we appreciate that, Rick, and I'll tell you, we've tried to do some things recently which we've become more aware of. There's always been mail order pharmacy. There's always been some other situations where maybe people don't get every prescription at one place. So we've actually tried to make it an initiative to find out what other medications people are getting from mail order or from another place, because it's just as important to check for drug interactions and incompatibilities. Like you said, maybe they're seeing a cardiologist and a family practitioner and an internal medicine doctor and a gastroenterologist, and if they're all writing for the same drug, that would be very bad.
Correct.
So please ask questions. Don't be afraid. We want to be accessible. We want to be able to help you guide through your medication regimen, and we want to make it simple and effective. But sometimes we're happy to work with you, but you've got to ask the question. So don't be afraid to ask.
And going to that real quick, one thing you taught me that I've told almost everybody I talk to is that they have to ask you, due to certain parameters within your contracts, if you have any specials. And you gave one example where a drug could have been $100 a month versus $10 a month. But they have to ask you. So when you go to your pharmacy and it says, do you have any questions? The first one should be, do you have any specials on this drug regimen? Am I correct?
Well, you are, but now since it's finally 2020, we are not restricted by any government or insurance company law to say, hey, Mr. Jones, if you got it on our special loyalty plan, it would be $10 cheaper. So now we can do it, but still ask the questions, because just like you said, in a busy environment or patients in a rush or, the phone's ringing, we don't want to overlook the opportunity to look at that. But we do try to flag medications and be like, let them know if they're on this med that they probably could save money somewhere else.
Correct.
So,
on occasion, too, there's a whole raft of coupons available for certain prescription drugs. And we're finding that many pharmacies are not telling, the patient that it's available.
Correct.
And it's right in the software, okay? I benefited from one that took my copay from $40 to $5. So that's kind of a serious amount of money if you do that every month.
Yes. And again, that's where coming to you guys and helping with all of that becomes as a partner in healthcare. But you need somebody local that you trust.
Yeah. Some of the other operations are just so busy and they're shorthanded. We can't have time to do this.
No, I understand it. Same in my world. Yeah. Some pretty big insurance agencies out there that don't necessarily give you personal service.
Exactly.
All right, well, let's talk about something that's really been interesting for us in the past couple months. Let's talk about preferred pharmacies. They're becoming more common, and I think it's kind of interesting. What does this mean as far as copays? Generally, in our experience, the insurance plans are telling patients their copays are lower at the preferred pharmacy, but many people may not know this often results in Medicare patients reaching their donut hole faster and therefore paying more on an annual basis than they might if they did not use a preferred pharmacy. Can you comment on this?
Oh, I can. I obviously have a passion for healthcare and what I do, and part of why I have such a passion is I always want to pull back the curtain and see what the wizards got going on back there. And one of the biggest mysteries and non-disclosed is what we call the PBMs, the pharmacy benefit managers, that are basically the conduit between the pharmacy companies and the insurance companies and yourself. So what they do, the big boys, is that pricing of that drug may not necessarily be at a lower cost to that insurance company that they're calling a specialty. But on the back end, that overpricing of that prescription, they give out and hand out what's called rebates. That rebate may go to, well, for sure goes to the PBM, the pharmacy benefit manager.
We don't get it.
Good point, good point. Sometimes goes back to large employers, and most of the time is shared with the insurance company that's telling you to go to that specialty prescription program. So if that drug internally is more expensive, even though they're paying a lower copay, they may hit that donut hole that they would not hit normally in a quicker fashion, and then they have this large cost to them on a drug that they thought they were saving money on.
We recently took a beating by being removed from a primary on an insurance list. And what do you think is do you have any sense of pricing between being preferred and not preferred?
I can tell you, those costs are all over the board. And again, it's a complete mystery. It's also political. It is political, and sometimes
that's what we think too.
Yeah, and the big boys, unfortunately, have an unfair advantage. But trust me, everybody listening, that does not mean that you're going to save long haul by not using the medicine center or somebody similar.
Sure.
And it also doesn't mean that you can't use the pharmacy you want to if they're not the preferred. So, you have a right to choose your pharmacy.
Okay, you're listening to Health Matters. Our final break is here.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Men like Paul White love Studio Arts and Glass. Why? We wrap all of his gifts. Gifts like hand-blown paperweights, ornaments, jewelry in stunning sterling silver and precious stones like amethyst and crystals. After 30 years, Studio Arts and Glass is known for creating and restoring stunning stained glass. Just ask Paul White. Studio Arts and Glass on Apple Grove and 77 in North Canton.
We've extended our most recent sale at the Half Off and Hot Buy store in Louisville and have added a lot of new items. All lift chairs are reduced to $199 with many in stock. All seasonal merchandise is drastically reduced, as well as a wide selection of health and beauty products, cough, cold, and vitamins. And shop our tool aisle and toy aisles to find more bargains. Take time to shop our store and you'll find many, many values. The Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Welcome back to Health Matters with the Medicine Center Pharmacy. We're talking with Rick Pikes from Pikes Insurance.
All right, a couple housekeeping things real quickly. Just a public service announcement that on Thursday, February 6th at 6:30, we are going to have another low-dose naltrexone and CBD oil information session at the Hampton Inn in New Philadelphia. Check out our website at medshoprx.com/events for that info, and we welcome you to bring your questions to our event.
And the date again is?
February 6th. All right, Rick, we have the ability to use a tool in the pharmacy to help patients. We get a lot of questions about what Medicare plan should I pick, and we're not allowed to tell them what plan to pick, but what we do have is the ability to take all their medication data and help match it up with all the plans out there, and then they can see their copays and deductibles and out-of-pocket expenses by plan, and they can help make an informed decision. So the thing that makes me crazy is that patients sometimes are like, I'll stick with XYZ plan because I've had it for years and I know it. But they might pay $1,000 more out of pocket a year. Mm-hmm. Can you talk about any experience you've had with patients and being maybe beholden to a plan, but we really need to shop around?
Yeah, first of all, I commend you for doing that service. That's outstanding. Another example of what you do differently. Because every Medicare Part D plan has its own list of prescriptions that may or may not accommodate the patients you're working for. So I guess my advice would be, first of all, that person work with you in conjunction with a consultant that's independent. We do have two in our office, and I say independent, not working directly for the Advantage plan, but they have two choices. They can get a Medicare Advantage plan or a Medicare Supplement plan. They have 6 months from the time they turn 65 to do that without any issues. After that, they have that open enrollment period that they have to go to in order to get on board. There's a slew of options like you just mentioned, and unfortunately that population sometimes does get overwhelmed and does not want to make a decision that may be best. So I say seek trusted advisors. Yourself, along with somebody that understands the plan side, understands their health needs, so that they're not just looking at price, but they're looking at coverage, because coverages are not all billed equally. Advantage plans are managed care, and they do have gaps and holes that may not accommodate that patient. So you want somebody that understands that language to work in conjunction on their situation.
Correct me if I'm wrong, but technically, all Medicare Part D and all Medicare Advantage plans are supposed to provide services on a level playing field for a similar out-of-pocket expense. Is that correct?
You're correct, but there's many tiers to those. And
but my point is just because you choose plan ABC over XYZ doesn't necessarily mean you are going to compromise your health care, but you could get better value for the same service.
Correct. And again, the Medicare supplement, or when you're talking A through F, they're identical. Just different carriers. But when you talk about Advantage plans, managed care, they go from no premium because they're paying part of your Part B, but those are really scaled back coverages to a lot higher premium for better coverages. And those are the ones with the open enrollment on an annual basis.
Cool.
Is there any discussion, and this is kind of off the record, is there any discussion about this new coronavirus in the insurance business? And what's cooking here?
That is such a new subject, and I have not.
I mean, I can't believe it's not going to be here in a couple of months.
I hope not, and it is a frightening thing. But I have not heard any discussion on it to this date.
Okay. So why don't you? We don't have a lot of time left. Why don't you tell our listeners about all your services, how you can help, et cetera?
Thank you. Basically, again, we've been there since 1974. There's over 20 associates working for Pipes Insurance Service and MAP Investments. We do all types of insurance investment products. Of course, I do focus on the employee benefits, but that's one division. We also do commercial property and casualty insurance. We also do individual property and casualty, your home and your auto. We've talked about senior products. We have specialists in that. Individual health insurance, and then again, we have another company called MAP Investments that can help with investments, as well as life, annuity, disability, those types of things.
I see. Got it all, don't you? Wow.
We try to diversify. We're just as subject as you are to government intervention, so you got to diversify.
How about our listeners wanting to contact you? How do they get a hold of you?
Well, I appreciate you saying that. We're located on West High Avenue in New Philadelphia. Our phone number is 1-888-328-8958. Our website is simple. It's pipesins.com. And if you want to email me with questions, or if you have any thoughts that you'd like to talk about, it's rick@pipesins.com.
What do you see? How about a nice little summary tied up with a bow, Rick, for listeners to remind them on how to be frugal when choosing their insurance expenses and their benefits and making decisions before they incur expenses?
Since most people are insured through their employer, don't look at your employer as the enemy. Where I've seen success, and I've literally seen a lowering in claims year to year, is on those cultures that take time to happen, where the employees are working with the employer. They're creating plan designs that cater to good consumerism, consumer-driven healthcare. They're giving them tools to stay healthy. In some cases, they're even giving them the medical care. But they're working together. There's benchmarks in place. They all realize they're in this problem, that healthcare inflation is a national problem. It is not the employer problem. And what can they do as a subculture to control those costs and work together?
So a team working together to frugally use their benefits and stay healthy, you're seeing that their plans are having lower increases and better return on their investment for their healthcare dollar?
Correct, yes. And I have direct proof of that in many cases, yes.
Excellent. Now, this could be someone perhaps who's seeking out multiple doctors when they don't really need it, adding more cost to the insurance visits, if you will.
Yeah, that's exactly right. Right now, we have so many specialists that sometimes they're going directly to specialists and they're not really seeking their
They don't need a
practitioner.
referral, yeah. And that seems to be pretty much the game plan now, that a lot of them just don't need a referral.
Correct.
Whereas in the past, you used to have a referral to go to a specialist.
That's interesting you brought that up. The HMO and the point of service plans, you had to do that. But now that the PPOs are out, they can use anybody on that list of doctors and hospitals.
Sure. Okay. Thank you to our guest, Rick Pipes from Pipes Insurance. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your health care provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and, of course, JD, our technical producer. As always, we thank your listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we see you next week right here, 9 a.m. at News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com.